Health Watch is presented by UMass Memorial Health Care. Here, caring for you.
What are antibiotics?
Antibiotics are medicines that are designed principally to kill bacteria. Antibiotics will not work against all infections. Antibiotics as a general class refers more to, and maybe we should call them antibacterials, because they will help with most bacterial infections, but viral infections they'll have absolutely no effect on. And in fact, the side effects could make your life a little bit worse. They also won't work on fungal infections.
What does the term antibiotic resistance mean?
Antibiotic resistance is a very important term for people to understand. The resistance means that you have a bacteria that we might give you a drug that 50 years ago would have worked on that type of bacteria, but now that bacteria has developed a way to get around that antibiotic. So that antibiotic isn't working to kill those bacteria. It's basically become, for that bacteria, useless.
How does a doctor know when to prescribe an antibiotic?
For myself, I will talk to another doctor before I start an antibiotic. I wouldn't prescribe one for myself. I won't even prescribe ones for my family, as much as when I have a 2-year-old who's sick and I really feel like I want to start something, I really want to start something. But I know as a physician that it's very tricky and that antibiotics themselves can have side effects. So I usually go to somebody who's impartial, somebody who's not invested emotionally in that sick person to help me make that decision for me. And when you go to determine whether or not to take an antibiotic, if you're prescribed one, it's really important to take all of it. It gets back to the point about antibiotic resistance. The reason we have antibiotic resistance is because physicians tended to overprescribe too frequently antibiotics to people for things that were just a common cold that they would have gotten over on their own. And people on the other end didn't end up taking all of it. You save a couple pills in case you get sick later on, that kind of thing. So you just end up killing off the weakest of the bacteria, but the strong ones survive, and they end up being the resistant strains.
We always hear that someone's been on an antibiotic for a couple of days and that he or she is good. What does this mean?
It's a good question. It's not always true. So especially if it's the kind of thing where little Billy's been on it, he had it for 2 days, I've got half of it left over. He might seem good right now, but ultimately there's a good chance that there's something that's still living in him that has just been strong enough to get by without being killed by the antibiotic. And if you do that enough with enough different kids, the chances somebody's going to come up with something that we have a real hard time treating that makes them sick enough to maybe go into the hospital, that's increased.
How important is it for a person to take an entire antibiotic prescription?
Definitely important to take all of it. I strongly, because of the ability of these bacteria to, some of them survive and to mutate, you really want to make sure you take all of it to kill them all so that they don't come back stronger than ever.
How does a person know when they need an antibiotic?
If you've had a fever and you've had it for a couple of days and it doesn't seem to be getting better, that's a time to talk to your provider, your healthcare provider. It doesn't mean that you need an antibiotic. Generally speaking, if you're a relatively healthy person most of the time, it's hard for you to know whether or not you need an antibiotic. I have a few patients who might have very difficult chronic medical illnesses who have had bacterial infections or other types of infections in the past. They're very aware of their health, and I've dealt with them dealing with infections a number of times, and in that case I might give them an antibiotic and have them seen in the next day. But generally speaking, it's hard to know whether or not you need an antibiotic until you've actually seen the doctors.